Have you ever felt the need to make a physical gesture at someone or say something to them? And by not doing that, your brain begins to obsess over it until it's the one thing that you can think about? That's kind of like what it is to have a tic. A tic is an involuntary movement or vocal gesture that you make at someone, and it feels like almost like an urge to say it. Now, the urges almost feel like an itch, and by itching that, you only feel itchier and itchier the more you do it. And if you were to have this for more than 1 year, you would be diagnosed with something called Tourette syndrome. Tourette syndrome is a psychological disorder which can cause a child to have motor or vocal tics. Now, normally, people begin showing symptoms of Tourette syndrome around the ages of 6 or 7. Now, these children have a very difficult time in school and their social life because they pretty much just can say whatever they want or do whatever they want, and there's no way that they can control them. And if they do attempt to control them, it causes a lot of discomfort for the child. Now, the main stressors that can cause a child or a person to have tics are depression, anxiety, environmental noises, which may set it off, or genetics. Although there is no known and exact cure for Tourette syndrome, there are a few treatment options available. Treatment options include habit reversal treatment, comprehensive behavioral intervention for tics, and exposure with response prevention. HRT and CBIT have been found the most effective in treating Tourette syndrome with a 33 to 50% response rate. The best way for someone to get treated for Tourette syndrome is by detecting the signs of Tourette syndrome early and getting treatment while they are a child. The problem for children with Tourette syndrome is that their tics are often mistaken for them misbehaving in their education life or their social life or stuff like that. Because of this, it is very hard for people to notice that a child is having Tourette syndrome and their treatment gets delayed. I feel like it is important for us to learn about Tourette syndrome because a lot of people misunderstand the disorder and just take it as them misbehaving. And because of this, I think it is important that everyone knows how to handle somebody when they are having a tic in the public life. Having Tourette syndrome already affects one's social life very severely. Being out in public is almost impossible with someone with Tourette's because that tic might garner a lot of attention and cause people to look at them. This is especially true in people who experience vocal tics. A lot of times when a person is having a vocal tic, they tend to blurt out very obscene and rude gestures at other people. This is very hard for them because they don't actually mean what they're saying. It's just that the fear of actually saying those things and thinking of them actually causes them to have anxiety and make them tic and say those things. If you're around somebody who has Tourette syndrome in public, the best thing that you can do is not notice that they're there or pretend to notice that they're not there. This could help because it would allow them to feel a little bit more comfortable in the public and make it feel like they're not being looked at constantly. Try not to laugh at them or point out their tics either. If you're talking with somebody who has Tourette syndrome, try to be polite and allow them to finish what they are saying and not interrupt them while they are talking. Most importantly, do not stare at somebody who has Tourette syndrome in public. It is very difficult for them to already be out in the public, so by staring at them, you can cause things like depression, anxiety, and stuff like that that they already don't need because it makes their Tourette syndrome worse. In conclusion, Tourette syndrome is a very rare disorder for someone to have. Researchers still do not know what causes a person with Tourette syndrome to tic. All that they have found is that the genetics of someone's parents is the cause for Tourette syndrome. Hopefully, in the future, we will all have a better understanding of how to adapt to it in public and find a better treatment option for people with Tourette syndrome. That's all I have for you in this video. Thank you for watching.